早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our ICON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do learn acknowledgement. We want to say that the UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members as patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health.
Today, we are happy to have Andrea Lau, registered speech pathologist, to tell us speech and swallowing rehabilitation issues. Andrea is a speech language therapist at St. Paul's Hospital. Starting in 2019, she's been providing support for stroke sufferers, including communication and swallowing. She has also worked in the medical and critical care units, helping patients and families what might be the changes that might happen after a stroke, and also promote safe swallowing and also recovery of function. Apart from her hospital work, Andrea also is the founder of speechvancouver.com. It's in English, Cantonese, and Mandarin to help individual treatment, to help the sufferers, patients after their discharge. They continue with their recovery, rehabilitation. She is also has got master's degree from the hospital. Thank you, Andrea, for coming to talk about communication and swallowing rehabilitation. Thank you, Barbara. I want to make sure I can change the slides. Okay, correct. Yeah, problem solved. Okay. Hi, everyone. I am a professional speech therapist, and also I'm the founder of Vancouver speechvancouver.com. I want to share a few topics with you today. I want to share a few topics with you. I want to have you help you understand speech therapies, the role played by them after a stroke, and also to explore communication challenges and swallowing recovery, and also understand patients' difficulty in communication and swallowing, and also help to improve their communication and reduce the frustration. So speech therapies, how can they help with stroke and brain injured patients? I have a few pointers. We can assess speech, language, voice, cognition, and swallowing functions. And also we can, based on the patient's goals, provide individualized therapy and plans. And we could support families and caregivers. We can also work as part of the healthcare team that will include, as you know, doctors, physiotherapists, occupational therapists, and dietitians, etc. Some patients may have swallowing problem. They might get choked, or they feel the food get stuck in their throat. Actually, swallowing is an inborn ability in the humankind. This action seems simple, but actually it involves a lot of steps. When the mouth and throat and any part has got problem, then you may have swallowing problems. Usually you can the symptoms see the speed of intake of food gets slower. You feel the food gets stuck. It's not up and down. If the symptom is more severe, the patient may be susceptible to pneumonia. In order to help patients with difficulty swallowing to eat safely, the speech therapies will do a swallowing assessment, and also according to IDTSI's national international standard, devise a personalized diet suggestions. Okay, I have several pictures. Okay, I want to say, for instance, how we can help. We can mince food, soft food, so easier to chew, and also use a blender to puree the food. And the puree food, I want to say puree food texture, even though is different from the actual food itself, in terms of taste, may not be attractive. So a lot of patients with swallowing difficulty, so the appetite would go down, causing the weight to go down, and also malnourished. Apart from that, the social activities and life quality may be affected, because generally in the normal restaurant they may not provide appropriate food selection, so it might affect them going out to eat the selection. Speech therapists can, through training and adjustment ways of taking food and habit, help them eat safely. And you can see from the pictures and the more recent research done on the patients swallowing difficulty, using different technology and equipment to help with our assessment, and also do relevant training. For instance, we can use X-ray to see at the time of swallowing the mouth and the throat condition, and we can use a special cup to drink more safely, and also doing different posture and different exercise to strengthen the relevant muscles. Yeah, that's the pureed food. Now I want to talk about after a stroke communication difficulties. There are 4 types. I see. I want to say first is aphasia. I will talk in detail about that. What is aphasia? Aphasia usually is because of the brain is damaged, caused by brain damage. When brain damage, is because of the cranial stroke or some trauma. A lot of the aphasia is because the left brain got damaged, causing it. Because our language zone is on the left, so if your left brain is damaged, it might affect our language ability. Language ability includes understanding and conveying. If the patient has problem understanding the language, sometimes they may not understand what the other person is saying, or even in more severe situation, they may continuously say a lot of things, but when people are talking to them, but they totally do not understand. So people sometimes they don't understand what other people are saying. And another thing is, in terms of conveying the message, sometimes the patient has a lot to say, but they are unable to say, or they say different words. For instance, if maybe they want to say apple, but they came out with orange. So we'll say this is misspoken language. This time they want to say apple, but they say apple, but pronounce differently. So we say enunciation problem. How could they be helped? The language language therapists could do a detailed language assessment to understand the patient's understanding and ability to convey the message. When the patient's ability is understood, the speech therapists will base on the actual communication ability and daily communication requirement and their personal interest, and devise and appropriate training purpose, and also do some aphasia training. Hopefully the patient could be assisted to help them understand other people better and also clearly expressing themselves. Language therapies actually, in terms of training, oftentimes they sometimes use picture cards or use computer to help these patients through the training. Maybe the doctor has said that already. When is the best time to do that training? Actually, the sooner the better. If after a stroke, if they could start the language treatment as soon as possible, the result would be more satisfactory. What is dysarthria? because of talking, the relevant muscles weak, or sometimes it's hard to enunciate. This would affect what is said is getting more and more unclear, and also there's another one we call apraxia. This is apraxia. This means the muscles, relevant muscles, are normal in function, but it's hard to effectively control. So it affects when it comes to speaking, the sound and the oral movement, and the plan and the coordination ability. How could the speech therapists help? Where we would practice how to use a proper mouth shape, and also rhythm, and try to practice slowly speak it, no need to get impatient. And the fourth type, communication difficulties after a stroke, that's a cognitive communication disorder. There are 5 points. What are they? Memory difficulty, difficult learning new information or retrieving old information. Perhaps attention challenges, and dealing with information may be slower. And also in terms of understanding abstract ideas, problem solving, referencing, there might be difficulties. In terms of oneself's merits and deficits, that may be reduced. So as a speech therapist, how could we help? Usually we would work with occupational therapists. We would implement new plans, new strategy to deal with cognitive disorder. So
If the patient has difficult to express himself or herself, it can affect their mood, because when they try to express themselves and they are unable to do that, then it creates communication problems. And so I want to talk to you about this. Remember, so I use a filing cabinet to describe the information inside. Okay, they may be disorganized, but all the information is still there. So it may take a little bit of time initially to take out information, and together with the therapist, they can practice new technique, new strategies to store information and to reorganize the information. I want to give you 4 tips how to support communication with someone who has had a stroke, especially when difficulties arise in terms of expressing oneself. Now, first, you can use other ways to communicate, such as gestures, pointing at pictures, drawing or writing, or using whatever is available in the environment as reminders. Second, we can try to find out their degree of understanding, so we can verify and clarify. And remember, during the process of communication, we have to write out the key words and just the important information, just the key words. And if you want to learn more about how to help those who have difficulty expressing themselves verbally. Here there are some resources, some graphics. First of all, there is the Aphasia Institute, aphasia.ca. They have free information for even children and grandchildren and for family to communicate with someone who has aphasia. If the patient has difficulty comprehending speech, there are ways we can help. First, we can create an appropriate environment. For example, reduce background noise to ensure there is proper lighting so that we can communicate with each other. And finally, this is very important. We have to remember, we have to respect that person's ability to understand and articulate. So how can we communicate directly with someone who has aphasia? So we have to speak in a normal tone of voice. We have to remind him or her that I know you know what I mean. So hopefully that can encourage that person. So that ends my presentation. I want to encourage everyone, those who have suffered a stroke, that through the help of speech language pathologists, that they can regain their speech. Try hard. Don't give up. Thank you, Andrea, for having given us so much information about what a speech language pathologist does. It's a very deep science, right? So we have all kinds of training. So don't ever lose your confidence, okay? So slowly follow the therapist's advice and practice hard at home. Thank you again, Andrea. Here we have the ways to contact us, icon. So if you have more questions, you can either send them by email at iconproject.org, icon.support@upc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.